My name's Sam Kinman, and I'm the Executive Director of the European Pain Federation, EFIC. Pain affects millions of people in Europe, almost 1 in 5, and yet it's still not well integrated into European policies on healthcare. Today we're going to talk about pain and prevention, and how the prevention of chronic pain should form a key part of health policy in Europe.
Pain should definitely be part of EU health agenda. It influences, affects a lot of people, more than 20% of EU population. So it's a major public health issue. Unfortunately, pain has not been one of the most talked about topics in the European institutions related to health. There are other priorities like cancer, like cardiovascular diseases, etc., which are all important. But pain should definitely also play a role in the discussions in the European institutions. So I'm glad that we have these kind of events which are organized in a way to raise visibility of the issue of pain, of the problems that people who are struggling with chronic pain are facing. And I will do my utmost to also raise this issue in the European Parliament as much as possible. In general, healthcare also needs strong support, because now we are seeing a diminished interest from some European institutions like the European Commission, I would say also the Council. So health is not so much of a priority like it was during the COVID-19 pandemic, and this is something that we need to change. This is reflected in the next 7-year budget, the proposal for next 7-year budget, where health does not have as important role as it had in the previous one. And this is why we need to work all together, us policymakers, but also stakeholders, to make healthcare remain one of the most important priorities in the European Union, and pain definitely as a part of that.
Pain should definitely be in the EU health agenda because it is under-researched, under-diagnosed, and under-treated issue that costs a lot for the societies and economies, causes problems in the workplaces, and foremost is very crippling condition for people themselves. That actually is very, very mis and understood. So this is an issue we need to correct. And that's why we should have a special roadmap and a focus on pain as a part of EU for health.
It is a lot of evidence in our hands. We have a lot of evidence in our hands saying that pain, especially chronic pain, affects a lot of millions of people. It means that pain should be included into prevention strategies, into primary and secondary prevention levels. And of course, also, we need to understand that we can invite member states to build an ecosystem which can help integrate the prevention against pain in the rehabilitation system. It means it should be very high on the political agenda.
Vaccination does help prevent pain depending on the illness. So we know for infectious diseases, vaccinations can prevent complications from illnesses like shingles, also measles and rubella. We also know that vaccines can help prevent exacerbating NCDs or triggering new NCDs, which are also a cause of chronic pain. So generally, yes, vaccines do help with pain.
This was an excellent presentation from the MEPs, from our collaborators, from our research office, from EFIC and SIP itself, outlining the importance of prevention. Why is it important? Because we know the cost of chronic pain in Europe. We know how it affects people's lives, both psychologically, physically, socially. It's a biopsychosocial phenomena. It needs to be addressed, but prevention is the key. And that was the really, really excellent message that came out of today's presentations.
So this event was so important to realize that chronic pain and the burden it brings to people's lives, the families that support people living with chronic pain, does not actually begin after the fact. After a person living with primary or chronic pain, after enduring what is happening in their lives. So we need to take, and I think we've lived throughout the session today, the event today, a shift in our perspective and we need to see the things that we can do to prevent chronic pain. So we should begin with people. Early intervention, better awareness, and timely support can stop pain from escalating into long-term disability. And this can only work if patients are included from the very beginning in designing research, in shaping prevention programs, and in advising policymakers. So today reinforced that Europe's strength is its ability to bring together diverse voices, and patients must remain at the center of that collaboration. And second, that event, the event we just participated in, it showcased that we need coordinated action across sectors. So chronic pain is not just a health issue. It affects employment, education, mental health, social inclusion, and the economy. So it's an issue across the board. And if not anything else, it's also a political issue. So these discussions today showed that prevention can only succeed when health systems, workplaces, and communities work together, supported at the EU level and by the EU level guidance, funding, and research. The next EU mandate offers a unique opportunity to embed pain prevention into broader strategies on NCDs, digital health, healthy aging, and workforce well-being. So PAE stands ready to work with MEPs, the European Commission, clinicians, and researchers to turn today's insights into concrete progress. We will continue advocating for strong patient involvement, better data, equitable access to prevention, and support for research that help us understand who is at risk and how we can intervene early. On behalf of Pain Alliance Europe, I want to thank all participants for their commitment. Today's conversation brings us one step closer to a future where chronic pain is not only managed, but prevented, allowing millions of Europeans to lead healthier, more fulfilling lives, living in a more decent and a humane context, like we should and like we deserve.
My name is Patrice Forget. I'm professor of anesthesia and pain medicine. Pain is a companion of everybody's life. Sometimes we feel some pain, sometimes pain can be severe. For some people, pain can even become chronic and can be not only a symptom, just interfering with our life, but becoming a condition in its own right, can be really the central problem occupying all their life. Sometimes they feel abandoned. This is not acceptable. We have to develop strategies to help the society to support people living with pain. Ideally, we should even prevent pain. That's very important. We have to better fund research to try to identify people at risk of chronic pain and to prevent it as early as possible. Sometimes it may not be preventable totally, and then we have to prevent the consequences of pain. And we can do that. The system, for the moment, doesn't address the problem sufficiently well. People can be vulnerable not only biologically in their body, but also in their mind, psychologically, and socially, feeling isolated because of their condition that's not well understood, not well addressed. People would prefer to walk. That's important. We have to support them. Fair walk is good for pain, but they need to be supported by a system that responds and addresses their problem. That's essential. So it's a complex picture, a complex issue, a number of issues that we have to consider. But when thinking about the social impact of that, the potential is enormous. 4% of the GDP, 4% of the GDP represents the cost of pain. The potential is there. We have to invest into that because for the society, it's essential. It's an enormous burden. And first of all, we have to support these people living with pain. And later on, the benefit for the society will be high. Investing more in research, but having an healthcare system that better responds, better addresses the problem of people living with pain, and considering that pain is transversal, pain is everywhere, pain should be in every single policy when thinking about economical activity, quality of life, health-related quality of life as well. It should be everywhere. Finally, education. Obviously, we have to raise awareness on pain. People at low risk of chronic pain should be supported when they have acute pain to try to continue to go on, to continue to move, and then to feel protected against the risk of chronic pain. And when people are at high risk, they need to be able to access care and also to access the right information they need to be sure that they can better live with pain, better deal with the challenges they have to deal with during their daily life. And in turn, educating the professionals. Yes, there is still a lot to do to better educate professionals. A lot has been done, and a lot is still to be done. And educational activities, also organized and co-organized with patient and targeting professionals, is important. When we think about the communication between professionals, or the communication between professionals and patients, a lot is to be done to be sure that the right information, the right way to share information, and matching information is actually what does happen, making possible finally to go and to walk in the same direction. All that is important, and we can achieve that. We have to work together to be sure that we're inclusive in our approach and that finally the society will benefit from all these efforts. The burden is high, but the potential is high as well, and we count on you.
Dear colleagues, dear friends, prevention of chronic pain and its causing prediction of chronic pain are two among the most important pillars of pain management. We often tend to consider that chronic pain stems from ill-treated acute pain. And of course, in some cases, this is the case after chronic post-surgical pain is very often preceded by acute or subacute periods of pain after operation. And chronic low back pain is very often preceded by acute burst of low back pain, of course. But in many other instances, chronic pain is directly chronic. After stroke, chronic post-stroke pain has not acute phase. Painful neuropathy and a diabetic person is directly a chronic condition. And there are many examples about that. So in these cases, preventing goes through predicting.
So today we've been joined by healthcare professionals, researchers, people living with pain, policymakers, to talk about what we can do to prevent chronic pain and how we can implement chronic pain prevention in wider European policies on health and on NCDs. It's possible to prevent chronic pain. It's possible to have a major impact on people living with pain through prevention policies. Hopefully, as a follow-up to this meeting, we'll see policy action at European level and at national level.